Good morning, colleagues. If we could now start, it is just gone 10 o'clock, and welcome to the December board meeting of CCAM. This is the last, I can't believe I'm saying this, the last board meeting of 2025. I think it's a particularly important board meeting. When we last met in October, we took assurance on our winter plan as we enter this critical period for the NHS. Interestingly, over the last few weeks, we've seen a resurgence in influenza. There is the ongoing issue of industrial action by hospital doctors. And the Secretary of State yesterday was very open about saying the challenges in A&E with bed shortages. So I think we are now entering quite a critical period for CCAM and the wider NHS system. So I think today is another opportunity to reflect and be confident that we are doing the best to support the communities whom we serve, but also to make sure that we support our people in the important work that they do. That's my brief introduction. This is a board meeting in public. We have a number of observers who are very welcome, and there will be an opportunity for questions at the end. I'm very pleased to welcome again members of our shadow board. This is a really important initiative, and it seems to go from strength to strength. So I'm really, really pleased to see you here today, and we'll have opportunity to hear your comments shortly. I know, Margaret, you've got two new colleagues that you'd like to introduce, so perhaps if you could do that.
Thank you, Chair. So, I'd like to welcome Kemi Omiso, who's joined us. Thanks, Kemi.
Hello, Kemi.
I should do that without prompting. Who's joined us as the Head of Compliance. And Kenny Ajayi, see there he is. So he's just joined us as our first Safety Improvement Specialist, so background of human factors and ergonomics, who will definitely contribute to our safety profile. Thank you.
Thank you, Margaret. You're very welcome, and thank you for the contribution I know you will make to CCAM. If I could go on to just some housekeeping. We are a little short on non-executives today. This is partly due to ill health, and if I could just go through a number of people. Howard, who previously chaired the Finance and Investment Committee and has also chaired the Audit Committee, has undergone major heart surgery. Thankfully, he is recovering, but quite understandably, he is not here today. Online, we have Liz, our Deputy Chair, who unfortunately had an accident and has had some surgery on her arm, but I'm really pleased that she is here today online. Mojcan is on holiday. She gave us notice of that, as is Peter, our chair of our audit committee. Subo is giving a presentation at Brighton Make Ready this morning, but will be joining us for the board this afternoon. And Suzanne, again, sends her apologies. She is currently on the board of Dartford and Medway, and it is their last board meeting today, and she felt obliged to attend that, which I quite understand. But in terms of governance, I look to Peter. We are still quorate as a board. That is the case. Okay, can I just check? Are there any declarations of interest? Unless I hear to the opposite, I assume no. And the minutes of the board, Peter, anything you want to bring to our attention? No, otherwise, I assume that they are approved. That's good. Anything in the action log? I know there is the volunteer strategy, but that is being developed. Anything else?
No, that's it. Just the one open action in relation to the volunteer strategy, as you say, Chair, and that's coming back to the board in February.
Okay, thank you very much. Just then there is my report. Please take that as read, but I just wanted to make two comments. Since we last met in, I think it was October, we had the joint board with South Central Ambulance Foundation Trust, and I'm sure Simon will say a little bit more about this when we get to his report. But the members will be aware that at that meeting we agreed to proceed to the formation of a group model. The first steps in that will be the appointment of a chair in common and then a joint chief executive. I want to emphasise that I have been a great advocate of this move, and not for any other reason than I think it will serve the patients whom we serve much better. It will be an opportunity to collaborate effectively and to deliver real benefits. From a taxpayer perspective, there are also real opportunities to deliver better value for money. But I really want to give assurance that the formation of a group does not in any way mean that we compromise on our commitment to local communities and neighbourhoods as part of the NHS 10-year plan. This will still be a real opportunity for us working with our member in the group to make sure that we deliver local services that meet local needs. But it will be a real opportunity to deliver new benefits through collaboration. And we'll say more of this as we go forward. The only other point that I wanted to mention was I was fortunate enough a few weeks ago to attend the NHS Providers Conference in Manchester, a very inspiring and effective presentation by the Secretary of State. But what was also interesting was a series of presentations on AI. And what I was particularly interested in is it was not just AI in the context of improving administrative efficiency, but it was examples of where AI can actually begin to make a difference in terms of clinical care. And there was a very good presentation on how AI can help in the triage when we are looking at patients that need to go to A&E. And I think this was a major development going forward. So what I really wanted to say was the commitment of this board to look at AI, to realise the potential that it may have to improve services to patients. And at the board meeting in February, we will be in our private session having a more detailed conversation led by Nick, our Chief Digital Officer, and Paul, our Non-Executive Director, who has more experience of AI, and Howard, where we'll be looking at the opportunities for how we take this forward in CCAM. Anyway, those are my comments as chair. Unless there are any questions, I think we'll move on to the audit report. And I think I've got to speak to that. Is that right? Yeah, I previously, some of you will know, as Suzanne is not here today, nor is Peter, I said I would briefly introduce the audit report. There are two aspects to this. There is the audit report itself, which I think is very good news. There is a number of internal audit reports have been completed, which have given moderate assurance, particularly pleased in respect of medicines management and how that has come along. I was at Medicines Management Centre in Paddock Wood yesterday and was very impressed by what's achieved. And it's very good to have assurance from internal audit that that is operating very effectively, and our genuine thanks to all the people involved in that. There were also an internal audit report on our financial management issues, which again get moderate assurance. And I was also pleased to note that the way in which we manage policies and ensure that they're up to date and we monitor compliance has improved generally. The main issue also was a review of our compliance with national standards in respect of our ability to respond to emergency situations. And I was going to ask Jen to just give us an update on the second paper that comes with the audit committee on that and where CCAM sits in its overall national compliance. Thank you.
Thank you, Michael. Yeah, I'm really delighted to introduce this item to board. So this is for board assurance and sign-off and has already, as you've touched on, been reviewed by EMB and been reviewed by the audit committee under whose purview our EPRR assurance sits. So we should really celebrate here ongoing improvement in our compliance and resilience around emergency planning, response and resilience. So I have actually yesterday received the formal letter signing off our EPRR core standard assurance position as substantially compliant. So we're now formally agreed to be in a good position there. And that represents a further improvement. So our substantial compliance this year is, in a sense, a better substantial compliance with fewer amber areas for further work than it was last year, which in itself represented last year a significant improvement on our prior position. And I'd like to thank Lucas Hawkes-Frost, who's the divisional director in that area, and all of the staff who've contributed to improving both the process, the rigour, the assurance and the visibility of what we can do with our interoperable capabilities. So that's a really good position for us to be in. There is a more detailed paper available to board, which is in the pack, which sets out not just our EPR core standard position and that substantial compliance, but also sets that in the context of our broader resilience and specialist operations work, which includes working with the Emergency Capabilities Unit to address the Manchester Arena inquiry recommendations, working on culture improvement, working on ensuring the team is integrated into our kind of frontline divisional operations, and a whole range of areas that allow us to be to achieve that substantial compliant position. So I'd be happy to answer any questions on the paper, but in general, I would say this represents a strong position for CCAM to be in, and also in line with what you said, Michael, just to say this is a position where we're trying to develop this more regionally, and we've worked very closely with our colleagues at SCAS around both resilience and specialist operations, and we actually undertook the assurance process jointly with SCAS across the our ICSs and Hampshire Isle of Wight Bob ICSs. So that was a really positive experience, and that is our forward plan to work together in that way.
Okay, thank you, Jen, and thank you also to Lucas, who's not here today. I know the commitment that he's done, and I was really pleased to note the joint working with SCAS and the Isle of Wight. But could I first turn to Paul? I mean, you've been brilliant in your oversight, and any observations that you'd like to give?
Oh yeah, well done. It's a sea change from where we were actually. So you know, the leadership of Lucas and Jen has been great actually. But I've got a couple of questions, actually. The main thing was about trying to change the culture, and it does feel very different when you go and visit. But how do you measure and know you're making progress in that area? Yeah.
Am I on? Yes, so thanks, Paul, and thank you as well for your support to the team, because you've been extremely supportive in giving us that oversight through the board. So we do have a focus on enhancing culture and leadership within resilience and specialist operations, both in CCAM and jointly with SCAS. There is a more comprehensive action plan which we reviewed at People Committee on last week. Max, that's right, isn't it? And what we've got within that is quite a comprehensive set of metrics and measures that set out how there are 4 elements of that plan, how they will be measured to ensure that we are visibly and quantitatively as well as qualitatively being able to understand that improvement. I would note that we have seen very considerably improved kind of engagement from our staff in the area. So we've started to hear more from staff in resilience and specialist operations. We've started to improve where we are with staff survey, with appraisal, with those kind of measures that are, you know, I guess indicators of how well our staff are feeling able to participate in the work of the area. So that's really positive. The other thing I'd mention is we're planning to bring more EPRR metrics into the IQR. I think there is a placeholder in there at the moment, but we will be developing, it's in the update actually, some measures of our training compliance, but some broader measures about the capability that we can deploy as well. So that's on the IQR development plan for next year.
Yeah, thank you. It's really important because it underpins. I've got another. Is it all right to ask? Of course. Right. So we've responded really well, especially on the Manchester findings and things. But apart from one, which is our ability to respond under the worst scenarios, which is possibly the most important one, where it recommends we have a lot more DCAs, and there's no funding. Right. So I just wondered, do we understand the implications of that as a board anyway?
Simon with you. And then I'll Jackie.
Thanks, Paul. A really important question to highlight. So the Manchester Arena inquiry recommendations and their implementation is a national issue. And as you rightly point out, it is an issue of funding. That funding has not yet been agreed or secured, and it would have to be in addition to the budgets that we currently get for the core services. NHS England are currently conducting a rapid review through the National Ambulance Resilience Unit of the current bids, with a view to making recommendations in the spring as to how we would go further in this space. So it will have to wait for the outcome of that. We remain, I think it's fair to say, as a sector, concerned about the lack of progress in this space, and I welcome the opportunity to put on the record this board's support for NHS England's review, and indeed asking for their update in the early new year about where we are, where they are on this, and whether they intend to fund the Manchester recommendations in full. So thank you for raising the question. I will continue to advocate on our behalf in those national conversations.
Thanks, Simon. If we can record that as something we would return to at a future board. Thank you. Paul, any other questions you'd like?
Well, there's only another one on that one, which is about the business continuity planning, because we've done really well on lots of things, but we're a little bit behind on getting all them in order. It's from the way we work with that.
Yeah, we are still working on that, Paul. I mean, we are in a lot better position in regards to business continuity than we were, but absolutely appreciate that there's more to do. Where we have made a lot of progress is on the business continuity arrangements around our supply chain, so that's been a real move forward, but there are still areas of the trust where we need to kind of tidy up and update our business continuity arrangements. So that is, myself, I think it's more about the arrangements being perhaps a bit out of date and needing streamlining, as opposed to actually not knowing what to do in the event of a business continuity incident. So the team are working on that, and we are also exploring whether we could jointly use the business continuity planning system that SCAS have in place, which is very comprehensive. We had a demonstration of it when I went to their Thatcham base about a month ago. And so that is something that we're exploring, because that way we could have more coordinated business continuity arrangements, and it's it's a very good system that like links everything together. If you have an incident over here in this plan, it knows what other plan you need to enact. It's very snazzy. So we are working on that. So I do acknowledge there's more work to do there, but it is work in progress.
And thank you for all the work that you've done in chairing the subcommittee. I'm very grateful. But Jackie, you had a question.
Thank you. I'd echo Paul's sentiments on absolutely fantastic, and well done to you, Lucas, and the team for getting us into this much better position. I've got a couple of questions about training, if I may. The first is in relation to the strategic commanders, and it's great to see that the multi-agency Gold Incident Command training is up to date for the strategic commanders. I just wonder whether or not you're assured that we've got enough people that have got access to that training at the moment from a rostering perspective, because I noticed that we've got 4 on there, and that's a number that may need to be larger. And my other question is just around the emergency capabilities unit training shortage, and I know that that's been escalated nationally, and that's an issue that isn't entirely within our control. So I'm just wondering what's your level of comfort on that escalation kind of leading to us getting the training that we need for these people, and is there anything more that we can do internally to kind of mitigate the challenge that leaves us with?
Thanks, Jackie. Both really good questions. So there are actually 6 people on the strategic command, but 2 of them are acting up from the tier below. So that's why there are only 4 written on that line. And we are in the process. One of Lucas's other projects is reshaping the on-call arrangements for the trust, as I think board are aware, because actually we have perhaps too much resilience in some places and not enough in others. So we are actively doing that at the moment, with a view to relaunching all of these arrangements in the spring of next year. But we do have sufficient resilience for the moment, but I agree, I think it's not ideal. So we're looking to expand the strategic level slightly, contract some of the other levels, and also redefine and refine the command roles so that they are less focused on performance management and more free to respond in the case of an incident. So as part of our divisional structure, organisational change, we're embedding new arrangements about performance oversight, which hopefully will help the command structure to work better. So it's an absolutely pertinent question, and there are plans in place to address that. We had escalated multiply the ECU training shortage, and were about to put forward a proposal to deliver it ourselves when the ECU suddenly published a whole load of training dates. So the training shortage has been addressed in the short term, but we remain in conversation with SCAS and also, I think, through the Southern Ambulance Service Collaborative, just asking the question about what's the best way of delivering that training in the future, because ECU, it is possible that ECU might move towards more of a sort of franchising assurance model, and we'll be able to deliver it locally. But that would require us to have a conversation about how the funding flows work between the various parts of the emergency capability structure. So again, it's an entirely pertinent question and something that we are working on. But here and now, we have now got people booked on courses.
Thank you. Again, thank you, and echoing the commendations with the significant improvements in this area. It's really heartening to hear. This paper was actually discussed at the Shadow Board yesterday, so I'd just like to share something from the Shadow Board colleagues, if I may, that came in from that. There was some discussion around the training, but also around our general policy around whether people can have time out for some of this training, and with evidence cited of some doing this in their own time. And I just wondered where we are on that, and on what the thought is on people's access and doing it in their own time.
So would that be you? So,
Can you hear me or not? Yeah. Hi, yeah, thank you, Chair. Yeah, in terms of that, Karen, I mean, you know, the idea is that there is an agreed abstraction rate for training, and that people would undertake training in, you know, work time, and that they would have an agreed development plan in place through their sort of annual appraisal. So we wouldn't necessarily expect people to be doing that in their own time, but I will come to Jen if there are specifics around the EPRR training.
So Sarah, apologies, sorry, just to qualify that, I think it depends what the training is, and I was going to look to Jackie to comment from an education strategy perspective. So I think what we have perhaps experienced to date in the organisation is a lack of clarity and structure as to what training will be A, funded by the Trust, and B, paid, like effectively abstracted on Trust paid time to participate in. And there has been, in my understanding, some variation in the structure and rules around that in different departments, and also how well focused training that is undertaken is on the needs and service requirements of the Trust versus the preferences of the individual. So clearly we need a better structure, a more fair, transparent, equitable structure to undertake that, because clearly we cannot simply abstract and pay for training, any training anyone wants at all ever, and we need to make sure that the kind of distribution of training is fair and equitable and reasonable. But I agree there is needing to be, I think, Jackie, perhaps under the strategy, a process for doing that is reasonable. Clearly, if we want you to be a strategic commander or a tactical commander and you need to go on the tactical command course, then you need to be enabled to do so. There is a whole load of other training that perhaps isn't quite so clear cut. So I think it probably comes down to unwarranted variation that we should be addressing.
thank you for that, and thank you to the Shadow Board for that question. I think Simon wants to come in, and then Jackie, if that.
Jackie, why don't you go first and I'll summarise at the end.
Thank you. I agree entirely with everything that both Sarah and Jen have just said. For this kind of training for the strategic commander, tactical advisor, etc., I'd absolutely expect that to be in the individual's working time. It's a requirement for their role. We will be looking at a strategy later in this meeting, and in the development of that particular strategy, we identify that there is inequity across the organisation in terms of access to training. So that is something that we do seek to address as part of that training. But at the present time, training which is required for you to deliver your role, statutory mandatory training such as this, would be within your working day.
And just to, thanks, great question. As I'm looking at the Shadow Board here, my comment would be, in actual fact, one of the things I'd like to remind people of is that CCAM has got a very strong training and education offer. As I've said in the past, you can walk in off the street age 17, and 10, 13 years later you can be a consultant paramedic. And that has created, so we've actually got a proud tradition of supporting people more, in fact, than many other ambulance services. And when we look at our resources, we commit quite a large amount of money to this on an annual basis. There is a really important question, though, which we will need to debate with you and others, and it is this. What might we expect people to reasonably do as professionals in support of their own development, and what the core offer should be? And that boundary, I think one of the reasons why people have commented on that boundary is that boundary has moved depending on where you are in the organisation. And I think where we need to get to is perhaps a little bit more consistency in what the core offer is, and what the discretionary offer is, where you as individual autonomous clinicians might be expected to develop yourself. The strategy will start to prompt that debate, but it's one that we will need to return to, because I think we've had a little bit too much variation in what might be regarded as core, which has been core in one place, and maybe not core in another. Does that make sense, I hope, to colleagues? And so we're not going to solve that one today, but just so you know, I am saying it is very much on our radar as a list of things that we need to come back to.
I thought that was an incredibly enlightening debate, and I think it's interesting to reflect, and Paul will know this, where we were 2 years ago and where we are today. So genuine thanks to Jen, Lucas, and all of your team in the way that you've made this significant improvement. And I really reinforce the point, when I first came to CCAM, the message I got over and over again was that this was a good place to come and develop, and the investment in training and development and innovation was really, really important as part of the CCAM brand. So I'm glad to see that continues to be as such it should be. Anyway, can we move on? Next item, and Karen, you've kindly agreed to summarise what the Shadow Board thought yesterday, so thank you.
Yes, thank you very much. So just for information for people that aren't familiar with the Shadow Board, this is an excellent initiative that's been set up to hear different voices from across the Trust. And Max and I co-chair the committee, and many of the members are behind us today, as you've heard. So we had our meeting yesterday, and the Shadow Board considers a number of papers that have been put forward in our pack today and in other places. And so, as I said, we did consider the EPRR annual assurance. We also looked at the volunteering and community resilience, and we looked at paper, and we looked at the workforce disability and equality standards, the RES and DES standards. So I'd like to summarise some of the key points that came out. I should also say that there's been some experimentation with how we actually structured these meetings. And one of the things we did at the end was get feedback from everybody, and it's good to note that they felt that this was one of the strongest and best structured meeting that the Shadow Board had to date. So I think there is an evolution of how we're working together. And they particularly valued the input from Lucas Hawkes Frost, Danny Dixon, and Jackie Skill, who came to present the papers. And I think they felt that that was very helpful to have them there and have the opportunity to ask them questions. So I think that's something we want to continue with. And we had some good discussion around the various issues, and they felt it really brought the papers to life, which within the best of intention can sometimes be a bit dry. So they really felt this, I'm quoting, but not giving names. They also felt it helped to learn about the breadth of the roles across the organisation, and they felt that the Shadow Board is a platform that's helping them to view the Trust with fresh eyes and deepen their understanding. So I think that's positive. A number of the specifics, they did make a plea that they get their papers a little sooner, so that would be something that, if we can expedite, would be very helpful. They really enjoyed learning about the resilience training. I'm not going to say a lot more because we've had some discussion around that here, but I think one of the points that they really wanted to bring home, I think we did cover in the discussion the senior roles, but I think it's about the EPRR training for people on the ground that might need to do it. So hopefully that's something we can take away as part of the education strategy and consider that. They very much welcomed the development of the volunteer and community and resilience strategy. Again, training was an issue that was raised in relation to that, and they very much welcomed the increased collaboration between CCAM and the CFRs, the idea to bring them more into collaborative working under the new structure. And there was also, picking up on the observations in the paper, they'd also be keen to see an increase in community involvement and creating non-patient facing voluntary roles. And I think there was some discussion about how some of our staff might come back and participate. I know some do, but we had some discussion around that. There was also a suggestion that we could do something to strengthen links with local schools, and that could be a very positive step. And again, I think we've done that, but on this specific topic. Another noted that they wanted to see the strengthening of assurance across different areas of work, and defibrillator accessibility was something that came up as part of the CFR work, and looking at broader assurance pathways to be considered by us at the board. We had a really good discussion around the Res and Des paper, so thank you to Jackie and others for all the work that went into that. It was mentioned by one member that they were particularly struck by the discussion around the potential for bullying at work. And I think we were thinking together about how we might think more critically about what we have and haven't observed in our own experience and how we make a contribution to that. And I think there was quite an insightful comment that came forward about how we all need to be more consciously observant of the culture and the environment in the areas in which we work. I think in terms of, we had two presentations from members who'd been to observe the People Committee and the Audit Committee. And again, they found that a very valuable experience. They said it gave them insight into the workings of the committee. But what was interesting was they were really heartened to see that actually what went on in those committees and what was shared with them was very similar to the things that we were doing. So they felt there was real openness there, that there wasn't anything that was being hidden. And I think that's good in terms of ways in which we might build trust together. And last but not least, there was a commendation on the significant improvement in the CEO report. So that's probably a good point to close my summary and segue back to the CEO report. Thank you. Thank you.
Really take the point that the success of the Shadow Board must be that there's trust and confidence. And that's really, really important. You know, it doesn't come easily, but we need to continue to build on that. Because you are part of CCAM, you know, your views are incredibly important. Thank you, your summary was excellent. But I'll just ask colleagues, are there any questions? Please, Richard.
I was just going to say thank you for flagging the issue with the defibrillators in communities and the health inequalities that we've identified across the organisation as a shadow board. We'd welcome your help with that. As a board, we've been looking into this and the health inequalities associated with a lack of not only defibrillators but also lower numbers of CFRs in communities that are more deprived across our patch. It's part of our strategy to improve that through our model of care around cardiac arrest survival rates, and we've got a work stream associated with that. But any support that, or advice that we can get from the Shadow Board in how we're going to address that issue would be welcome. So thank you for flagging it.
Thank you, Richard. Okay. Any other questions? Can I ask the members of the Shadow Board at here today? I mean, Karen does an excellent summary, but was there anything that you wanted to add that you've missed, or anything you'd like to say? No. 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 Okay. That. I think it's been covered really well. Okay. Okay. Well, thank you, and genuinely thank you for your contribution. We really want to hear your views and to act on them as best as we can. Well, you've done the introduction to the next board paper, which is the CEO report. So this has got to be, Simon, really brilliant. You know what I mean? Yeah.
No pressure. Thank you. So it's right. Morning, everyone. Welcome to you all. Welcome to our new colleagues. It's great that you're here. It's great that we've got a new head of compliance. Much needed in these challenging times in which we live. It's right that we start with winter. So the first thing I want to do is to make a series of observations around winter. The first thing I want to say is, as ever, thank you to all of our staff who are working out in the front line over this period. We know already we're in the middle of a more challenging flu season than we've had in a number of years. I'm sure Margaret will cover this. She gave an excellent update to EMB yesterday about the makeup of the flu season and the groups in the population that it's particularly affecting. She'll do that much more eloquently than I could. But we know that that is a real issue for us. And so thank you to our frontline staff thank you to everybody who supports our frontline staff, because it takes a village to send an ambulance out. And I'm constantly grateful for the work of all of our Make Ready staff, all of our Churchill colleagues who help make the care that we are able to provide possible. This morning, two things are happening nationally that it's worth reflecting on. I was on my way, as I often do, listening to the Today programme. Other modes of news are available. And there was an item there this year which I think enables me to make a public comment about the fact that 200,000 A&E attendances between November and February last year were for conditions that could have been dealt with elsewhere. And that represents 2% of all attendances. Why do I make that point? Because some of those people will have rung us. And when I share with you that 6,300 visits to A&E were for nasal congestion, 83,000 visits were for earache, 96,000 visits were for sore throats, nearly 4,000 visits for ingrowing toenails, 8,600 visits for itching skin, and 384 visits for hiccups. That is what the data is showing us. So we all have a collective responsibility, we to deploy our resources wisely, but our public to use the NHS wisely throughout this period. And just to remind everyone that one of the common myths, which I'll take the opportunity that NHS England have talked about today, that patients can get prescription early medicine traditionally dispensed by GPs at pharmacists for a range of common conditions. And this is one of the biggest myths that we still struggle to overcome, that people think the only place that you can get prescription only medication is from a GP. But you can now get it for common conditions including sore throat, sinusitis and earache. So this is the reality. 2% may not sound like a lot, but think of it as 200,000 people who ended up in A&E. That is a significantly sized town. The other thing I just wanted to note this morning is that today we launch, or NHS England launches, its national campaign for winter, which is called 24 Hours Not in A&E. And I think that is an appositely titled thing, so I'd encourage us all to look it up, promote it through our various channels, and it explores the options available to 3 members of the public seeking health advice. It covers a GP appointment online, speaking to a pharmacist, and also NHS 111. And in that space, it's great to be able to report that Natalie Randall, who is one of our 111 clinical advisors, features. Good for Natalie. And thanks to her for supporting that campaign. It's great to have us represented as part of that national campaign. But, you know, this is one of the things where we can all of us, in all of our parts of the world, wherever we are, can make a difference to helping support the national effort to keep A&Es functioning over winter. More locally, we looked yesterday at the pattern of demand, and it is quite striking that since the 30th of November, more or less, or towards the end of November, demand has increased almost overnight, and we are now running very hot as a service. We're looking at a range of actions at the moment that we might need to take to augment our support over the winter period to make sure we are safe. We are also looking at how we can work collaboratively with SCAS in that space, because there is, we have to work together to make sure that every patient, no matter where they are in the southeast, gets access to emergency care, and I'm grateful to Jen for leading that work. We're currently looking at what that clinical disposition is, because it's very stark. We trot along at a relatively stable level of activity, then pretty much overnight it goes up to running the red. And the curious question is, what's driving that demand? If what we are doing means anything, we should be deconstructing that demand, looking at what its clinical makeup is, having conversations with the relevant ICBs about what more we can do to support it. Finally, I was pleased to note yesterday at EMB, this is last thing on the winter, and again, a public thing, we are doing well, thanks to Margaret and her team for leading the push on flu vaccination. There's more to do. We are ahead of where we were as an organisation this time last year, but there are still some deltas in terms of our performance at individual OUs, which I think we need to continue to have conversations with people about what's making people feel uncomfortable, if they are, about not having a vaccine, because again, it is something that we can all do to keep each other safe, not just in work, but in life. This year, more people, and I do want to emphasise that every year thousands of people die from flu. It is not a comfortable illness to have, and this year we're going to see more. So if you haven't had your flu vaccination, other myth-busting moment of the morning, the other common myth I hear is if you haven't had it by now, it's too late. Not the case. You can still have it. Flu comes back in waves over the winter period of time. I want to just now reflect on a few things just before turning to the future things. Over October, we marked Black History Month, and I was privileged to attend a session led by Everett Henry in MACA, the Medway African and Caribbean Association. Gives me an opportunity to place on record my thanks to them for helping lead that debate. And it's great that I won't spoil his thunder that Amjad is here this morning. Welcome, Amjad, to share his story. I'm doing podcasts now. It's a thing, podcast, and it's the Vogue. I'm reliably informed, and it was great to interview you as one of my first podcasts, Amjad. I've actually done another podcast which was really great, and it gives me an opportunity. I met yesterday because this month, still going, it's Disability History Month. Just want to draw out that in actual fact, when you look at the DARES data, you see a really quite positive story for this organisation in terms of the progress it's made. And one of the things that came out, I won't spoil all the podcast story, you have to go and listen to it if you want to find out, but one of the things that colleagues said to me entirely spontaneously was they can feel and see the progress the organisation has made in making a better fist of doing reasonable adjustments. So I just wanted to thank everybody who's been... For sure we have challenges, but one of the things that I think Kavita will say to us is we've also got to be better at telling the good news stories where they are present, and that is one of those. And just to note, Polegate's Steph Meach, well done Steph, has been elected Deputy Chair of the National Ambulance LGBTQ Network, which is very active, and it's a real honour to be elected into that space. It's also important to say this part of the year, since we last saw you, is a time for remembering, and I'm always very proud of the fact that CCAM decks out some of its ambulances. You will have seen this in the specially designed remembrance livery. And I know it means a lot to our colleagues in the Armed Forces Network and other of our very active networks, and it amplifies the commitment that we made and that we were recognised with in terms of our employer recognition scheme. Also good to see that the charity continues to go from strength to strength. I've asked that the board in future will receive half-yearly updates. It's important that we celebrate and continue to promote the work of the charity. I think you're all aware of my commitments in that regard. I look forward to delivering upon those in my own specially designed livery that amplifies the charity brand. On that, I'm looking forward on Monday to attend the Celebration of Life Carol service, which will be a great event. Gives an opportunity, I think, to plug the Seacan Choir, made up of many voices. Who knew that we had so many undiscovered talents within our midst. Turning to a couple of things in terms of the future. Firstly, the group. I want to endorse what Michael said in terms of his comments on the group. I think it is absolutely an opportunity to take, as our Secretary of State is the best of us across both of us, to slightly parse his phrase. This is not about anything other than recognising the strengths in both organisations and promoting them across both. So I'm delighted that we've made progress. It also gives me an opportunity to pay a particular tribute to Michael and his leadership in this space. We would not be in this place of being able to move the group forward if it hadn't have been for all the work that he has done. We should be rightly proud of that contribution. It will make a difference to millions of people going forward, and that, after all, is what we are here to do. We are now embarked upon a couple of points about the future. We're now embarked upon the planning round. Allocations have been released. The ambulance sector, I think, having looked at the allocations and having had a discussion to discuss this across EMB last week, has got a good deal. And I want to be clear about the fact that my expectation of the organisation will be that we move through that process expeditiously and deliver upon our commitments. We've got a chance to make good on some of not only the promises of our strategy, which I think continues to guide us, and just to be clear again that nothing that is being said nationally contradicts our strategy. In many ways, it's an invitation to go further, faster, particularly in the virtual care space. We will have an opportunity to try and address some of our capital challenges, and particularly maybe hopefully bid for some of the capital to address our remaining areas that don't have make-readies, which would be great. And we have an opportunity to still continue to improve the service that we offer. The government has an ambitious agenda. It is rightly ambitious on behalf of patients, and we are set on a journey to try and recover the sector back to 18 minutes over the next few years. That is no mean undertaking to get back to C2 at 18 minutes, and so we are going to start thinking seriously about that. Our first planning submission is due this month, and then there will be a rapid acceleration of the process into the new year. I should say, in as much as we possibly can, we are going to try and develop that work with SCAS. There are some opportunities that are significant that we should use the planning round to exploit. Our commissioners are rightly expecting us to work in partnership and to do as much as we can to deliver to set the group up. In other words, put simply, we shouldn't sit on our hands and wait for the appointments to be made. We should be getting on with delivering the promise that the group offers right now. So I will pause there. Happy to take any questions. Thank you, Michael.
Thank you, Simon. And I really reinforce the point that you made about the strategy. The strategy is really key, and it's guiding all that we do, and I'm pleased to see the reference that you made to that. Can I open it to the floor, please, to any questions that people would like to ask? Paul, please.
Oh, yeah, thank you. There's no end to the talents, is there? Right. Yeah, so well done on the report, very good. So I too listened to the Today programme. I wondered if we're logging similar types of calls, you know, when people have ingrained toenails and toothache and things like that.
So, funnily enough, we had a discussion on that very topic yesterday at EMB. One of the things that we will be thinking about, Paul, and we do have evidence of examples. Jen shared a couple with us yesterday about where we have an opportunity to think about what we do differently. Do we have people ringing us who could have not rung us in the same way that they could have not gone to an emergency department? Yes, that is a reality. And that's the reason why I started there, because in actual fact, this is an opportunity for us all to think about the NHS is a precious resource, but it is also a resource that is constrained. So we all have responsibility as boards, as staff, as citizens to make best use of that resource where we can. So we will be thinking about that too.
Thank you, Paul. I know, Liz, you've got a question. I'm sorry if I missed you earlier, but please come in.
That's fine. I hope you can hear me okay. Simon, I just wanted to lift out around Shani Korb, our chief pharmacist, and her achievement of being the first pharmacist from the ambulance sector to achieve a fellowship. I just want to also say that since Shani has joined us, the transformation she has made in medicines management, previously over many years, this was high on our risk register and always discussed. And I think, as you said, Michael, your visit to Paddock Wood and the Medicines Distribution Centre, and I think it just demonstrates that strength of clinical leadership. And thank you to Richard for supporting her as well. But this is an outstanding achievement by Shani, and I just wanted it recognised at the board.
Yeah, thanks, Liz. Completely. I mean, I did a shout out to her in my weekly video message. She wrote back to me to say her team's feed had exploded with people commenting on it. I think another transformation that has genuinely taken place, and colleagues will recall that, and you among them, Liz, were one of the ones who were very concerned about how our medicines management facility was 3 years or so ago. And now it is in a completely different place. But I would also want to recognise Shani's achievement. It is, as Liz says, the first time a pharmacist has been recognised in the sector. It also gives me an opportunity, I think, in the spirit of people who I forgot to mention, just to highlight that the Eastbourne Area Community First team, I have so much good news to share, it's difficult to know sometimes where to start, has been awarded the King's Award for Voluntary Service, which is an amazing achievement. It's one of those awards that only the Lord Lieutenant, and I had an opportunity to sit down with Richard, who leads that team, yesterday, to share with him all the work that they are doing. And in actual fact, going back to the feedback that Shadow Board raised, they are already in schools in the Eastbourne area teaching kids CPR, which is an amazing thing. So we need to spread that more, but I just wanted to acknowledge the contribution of the Eastbourne Area Community First team and all who support it. So you prompted me to do two for the price of one there.
Thanks, Liz. That was very well said. And Karen, I believe you wanted to.
Thank you, Simon, for your report. You mentioned the collaboration with SCAS and how we're going forward on that, and the important benefits that we all agree we're going to gain from that. I wonder if it'd be helpful for you to say a little bit more about what you perceive the challenges to be and how we might mitigate that
So I'll do two things. One is I think it's important to describe where I think the benefits sit. So the benefits that commissioners are asking us to explore are the development of one plan this year. We need to make sure that we're joining up on as much as we can in terms of that plan for the future. Remember, this year we're doing 3-year plans with a 5-year narrative, I think. Secondly, I think there's a really significant opportunity in the digital space. We have talked about this before. It's important that we make really good use on it. Third, I think the capital and estate space, let's be honest, we have, comparatively speaking, a phenomenal estate, thanks to the good work of many forebears of ours. SCAS do not. Fourthly, on the clinical model, there was some really good work. Some of you will have seen that was presented at the board to board, which again I think challenges us to think how do we do things. When you think about it, we're a comparatively constrained service in terms of the things that we do. But when you look at how we do them at the moment, you might as well think that we're in completely different places, almost we're comparing completely different services. And lastly, on corporate services, the NHS is challenging us to do better on our corporate costs, both of us. So those are the opportunities. And what are the challenges? Well, in actual fact, the first challenge is that the opportunities are so significant, working out the sequencing of them is actually quite a task. And some of them are time constrained. So some of them we are actually going to have to do right now, whether we like it or not. The biggest challenges, I think, often in these spaces, to speak frankly, are the cultural ones. It is not necessarily, when you look at the economics or the intellectual case for change, do you struggle to see the opportunities, though often those are really quite straightforward. It is actually history and tradition that you have to work your way through to find new ways of working. People are rightly proud of the organisations that they work for, and sometimes letting go of that to find a new space is the hardest thing of all, I think. And we need to remember that although there is a really practical component to some of these journeys, the emotional journey is the one that probably requires the most attention.
Okay, thank you, Simon. Unless there are any other questions? Yeah, Paul, please. And then.
Yeah, just a quick one. So I was delighted to see the progress of the digital transformation, and especially how we're using data, because we've been on the data journey for a while, and actually seeing it. So it'd be really good to understand when we're going to see a longer term strategy, so we can see it's a long journey, the data one. And I know you're working on it, but it's really good to see how we can actually look further ahead and capitalise on the great work we've done so far.
Well, I think I will invite Nick to comment here. He is the expert. No point in having an expert in the room if you don't invite him to comment.
Thanks, Paul. Yes, and this is a piece of work that's ongoing at the moment. It's being led by our Assistant Director for Data and Analytics. One of the reasons we're not completing it yet is because some of the investment we're making this year is changing our data and AI platforms, and involves running some pilots for AI, which are just in the process of being stood up for some initial clinical use for ambient voice transcription. So taking the call feed, the oral call feed, and turning that into a clinical transcription. Changing our data platforms gives us a number of opportunities, and we want to just learn a bit over the next 2 or 3 months as we stand that up as to the art of the possible, and finalising a strategy too early might miss some of the opportunities of the learning we get. So it is a work in progress, and it's absolutely something that I look forward to us bringing back to the board. Just don't want to jump too early.
Thank you. Can we record that as an action? I'm an auditor by background. I always like to have a date going forward. Thank you very much, but I agree totally with your approach, Nick. We come to the end of this particular item, but I just want to stop and say I'm incredibly grateful to the executive team over what they've been doing over the last 9 months. So I see a lot behind the scenes that go on, and I think the challenges that we've faced over the last 9 months have been considerable. But what I've been really, really impressed with is the agility and commitment of the executive team. And particularly more recently, I just named them, but I could name all of the executive team. The way in which Sarah and Margaret and Simon have responded to particular recent challenges have been really excellent. So tremendous thanks. I know it's not easy, but I want to go on the public record of making that thank. It's a really excellent performance. To the next item, and this is our board story. It's a real opportunity to hear from our people about the issues that are impacting on the organisation and the progress that we're making and the ongoing challenges. So I'm really, really pleased to welcome Amjad to come to the board and talk about the work of the Inspire Network. This is really, really important. So Amjad, over to you, please. You're very welcome.
Thank you. Shall I just introduce Amjad? No, not at all, but thank you, Chair. So Amjad, delighted to have you with us. Amjad Nassar, many of you will know, is our Head of Health and Safety, but more importantly for today, and for many a day, he is our Chair of the Inspire Network and has had that position for just over a year now. And in that, guys, we've asked Amjad to come and provide some reflections from the network, as particularly poignant following the Black History Month. And again, I would like to express my thanks to Amjad and Caroline and Dawn for the work that they did. We had a really, really good, robust Black History Month with some really interesting information and discussions being held across the organisation. So with that, I'll hand over to you, Amjad. Thank you.
That's it. Okay. So what do you want me to do?
You needed a technical run through, didn't you? So you're on there. Amjad, you're on the screen.
Excellent. Okay. So just a quick run through of the structure for the Inspire Network. Obviously, myself as the chair of the network. As Margaret said, I've just been in post just over a year. Basha, who joined us as deputy chair, that was a new appointment. That was about a month ago now. He's a paramedic and he's based out in Kent, so it's great to have that connection with the front line as well. Margaret, obviously our executive sponsor, and Modjan, who's our NED sponsor as well, and obviously internal support from Caroline's team. Our strategic partners, HR, etc. So yeah, it's nice. Everything seems to be working together. So that's our leadership structure. So just a refresh of what Inspire actually is. There's a number of staff networks. So it's CCAM's cultural diversity and faith network. And I think sometimes the faith element is forgotten about. So we've put together an annual calendar for next year, which covers all key religious events, and we'll put that out and to make sure we don't forget any key celebrations, etc. So the next couple of slides will just focus on issues, things that were highlighted to us as possible areas of improvement. So the first one is around, so this is sector related, around the ambulance sector. It's back from 2024, around cultural reviews. Some of the bits that came out of that were weak speak up, freedom to speak up pathways, poor follow through on reported concerns, staff being affected by basically discrimination from the public. So our response to that from the network is that we're holding 2 sessions per year for Freedom Speak Up to come in and provide that safe space for staff to actually, one, be more aware of what the role is all about, and to actually just have that sort of comfort of knowing that they can raise a concern. We've already had one this year, and we'll do the other one later in the year. On the violence and abuse side, we've had our security manager come in, and we've had that one session already as well this year, and we'll continue that going. And then it's just about the support and well-being of BME colleagues. So I've been networking a little bit with other colleagues in the same role, and we just look at sort of promoting more services that we can have that further supports our colleagues. So here's some snippets of things that got reported to me. So this goes back from the early days of when I took on the post. Some of this is commentary. We've not been able to actually find the evidential bit yet. So things like CCAM seems like a lad's culture on the road. So the road element is frontline. And colleagues were just not interested in the ethnicity or religious beliefs of others. Sometimes it feels like corporate staff are removed from what the reality is for BME staff. Operational staff have left the trust due to being treated differently about their race, and that's a comment, so we do need to dig deeper with that. Concerns about being ignored, minimised or not taken seriously. And things like pressure to fit in, fear that raising an issue perhaps might make things worse, limited career progression opportunities, and underrepresentation in senior roles. So what we've started to do is, in response to that, is invite colleagues who have gone on various training programs, so Ascend and Reverse Mentoring, and they've come to some of our meetings and actually just provided an overview, the benefits, the journey, and certainly on the Reverse Mentoring, that was a really interesting bit of work that was done there. So, and we'll keep on promoting that. Anywhere we have opportunities where staff can go off and develop themselves and access, we'll do that. Obviously, you heard from the Black History Month, the various bits that we did. It was a brilliant month. When I look back at what we did when I first took post, there wasn't very much at all. And where we are this year, it was really good. And the support that we had certainly from board, it was brilliant. And there was a series of podcasts as well that went out that's still available on the staff intranet as well. We looked at representation saves lives, so that's an interview with call handlers, allyship on shifts, the power of being heard, and that was a conversation with our FTSE team, and power and pride in practice, and that was an interview with myself and Karen, who is the chair of our GEN network. There was some community outreach work that was done in the month of October as well. That was over in Crawley in the County Mail. That was a real great awareness session to actually see the public can actually see the roles and all the things that we have going on in CCAMS, but also to differentiate that we're part of the NHS service rather than how some would see us perhaps as an emergency service, just like the fire and the police. And I think we need to do more of that as well in other regions. So just a quick run through of the priorities that we've set for the network, and that's strengthening training and development. And as part of that is about training to better reflect population diversity, improve cultural competence across the workforce, networking engagement and collaboration. So we'll still continue with our structured bi-monthly meetings, and we'll work with other BME networks as well, and expand our reach and look more on the faith side as well, and look at what we can do to further benefit our staff. So shared learning and system improvement. So we'll continue to grow our membership. Already we've had an increase of about 25 new members come on board, which has been good, and that's from the outreach work that we've been doing internally as well. Inviting other NHS trusts to come along and share some good practice and challenges that they've had and how they've overcome that as well. And just sort of that sharing with colleagues from a wider network. So the support and inclusion for international staff. We'll be inviting sessions for international staff to come in and talk us through their journey and where things went really good and perhaps where we could have improved from. And just look at making that whole process smoother. And culture identity, deliver events highlighting cultural heritage and personal journeys, and show honourably and faith leaders to foster aspiration. We'll invite subject matter experts to look at health inequalities and explore microaggression and health stigmas around workforce issues. And that concludes the presentation.
And thank you very much for that,
Thank
and
you.
thank you very much for what you do. The presentation was incredibly rich, and there are a number of issues that I don't think we've got time to explore. I really support what you say about faith, because I think understanding different faiths is really important, because it enables you to challenge yourself, and it enables you to understand much better the communities that we're serving. And actually sometimes you can get things wrong for all the you're trying to do the right thing, but unless you understand somebody's faith and their values, so the more that we can do. I was particularly concerned, and I know there's been a national debate about this, that where our people and the wider NHS get abuse when they're from patients, which is totally unacceptable. I spent my one question to you, and it's a really difficult one, is you were involved in the engagement activity in Crawley. If you spoke to, I don't know, a Sikh community or a Bangladesh community, would the ambulance service, the paramedic, would that be something that they would think of as a natural career somewhere that they would feel really welcomed?
So from friends, etc., outside of work that I've spoken to, when I asked the question about the ambulance service as a whole and paramedics, etc., they don't make that connection. It's NHS.
No.
So they'll associate it with just being a blue light, as in police and fire, and that makes people hesitant for their own reasons. So I think raising that awareness that it is part of the wider NHS,
So
that
really,
helps.
Really should be a priority for us, I think. And can I ask? I did speak to Modcon, who sponsored. One observation that she made was, were we doing enough to support you in terms of as a network? I'm pleased. I hope we convey to you that we really want to know your honest view in this. Could we be doing more in this space?
I think we can always do more, definitely.
Yeah, I know.
I think at the moment we're probably at the right pace. So there's one about growing the membership, which is what we've been doing, having more structure. But I think further onwards we could perhaps invite not just the exec sponsor and then but also some of you guys to come along as board members, just to have a 10-minute session, and we can pick a subject on that or keep it as an open forum. But that support actually does help to keep that culture going.
That's very helpful, and we will take action on that. The final question, then I will open it up. I was really pleased to see later on we've got the RES data, which is for the first time the board is beginning to look at data, and it does tell some interesting stories. Are you happy with that? Is there any other information that you would want us to be?
No, it's good to see the positives from that. I don't see we're not going backwards. There's more stabilisation and sort of going in a better direction, which is great.
Okay, thank you. Can I open it for questions, please? Richard and then Seb. Oh, sorry.
Thanks, Amjad. Brilliant presentation, really interesting. I went to an event with the CQC where they were encouraging organisations to consider the terminology they use for staff, and they were suggesting there's a move away from the terminology BAME towards global majority. I noticed you were using BAME in the presentation. Do you have a sense from the network about what this organisation should be doing in terms of terminology that staff would recognise and accept?
That is a good question, and it's almost like labelling as well, like to a certain degree. And I think there is scope to change that. We should look at that a bit better. And I don't know what we would change that to, but yeah, I think it doesn't. Even when I put it in presentations, it kind of doesn't feel right. Yeah.
Yeah, thank you, Amjad. Just to really say a massive thank you on behalf of the board to all the work that you do and continue to do over and above. You know, I think the commitment you make is really outstanding. So I just wanted to say one of our priorities for EDI this year was about support to the chairs of the network. So I hope you have felt more supported in your role. And really a commitment from me to say that we will continue to do that in the coming months and year to make sure you feel that support. And also in your comment around trying to, I suppose, build the network further so you get, more membership and how we can support that. So just to really commend you and to thank you for coming today. I think what we have tried to do as well is to introduce the network chairs into formal committee meetings so that they have a voice. So so network chairs have attended the People Committee and also for the first time the Joint Partnership Forum, which was with our trade unions. So I think I hope that with your increase in profile and voice, we are showing and demonstrating real commitment to our staff networks. So thank you.
Thank you, Sarah. Liz, did you want to come in?
Yeah, thanks, Amjad. And I have to declare, Amjad and I worked together in the past in London. So Amjad, my question for you, and great presentation. How different have you found it culturally in the Southeast around inclusivity versus London? Because it feels so different.
Yeah, it's very different. And I mean, Surrey generally feels different in its divide as well. But there are large pockets of sort of population there, and I think there's an element of, certainly when we look at the violence and abuse side of things, I think there's an element of training, educating public as well about acceptable behaviours too. So, but yeah, there is a difference certainly.
Liz, do you want to expand on that? Because I think it's an interesting point.
I just want to I guess from Amjad's perspective as the chair of this network, in terms of how can we change that perception and broaden our reach to those communities. And I also am aware we're doing a piece of work through our health inequalities as well. But I think it goes back to your recruitment question as well, Michael, is how do we change that culture within CCAM as an organisation that is a huge challenge for all of us to support Amjad with?
I think that's the nub of it, Liz, from my previous executive career. The only way you change an organisation is if you change the people in there. And that's no disrespect for the existing, but we just need to be a more diverse mix of people within the organisation to reflect the communities that we serve. And I think you have to be really quite active in your recruitment approach. But I'd just like to open that up. I'd like to go to Max and then Margaret and then Simon, please.
Thanks very much, Chair. I will join the chorus of thanks for both your presentation and the hard work as Network Chair. And you set out some really clear priorities for the year ahead, so thank you for that. 3 points of encouragement, if I may. The first one, you mentioned a joint podcast with the Gen Network. Do really try and explore those opportunities for intersectionality in the year ahead. You mentioned some great development opportunities or schemes that you're bringing in terms of the feedback and insights from into the network. Consider the Shadow Board as another one of those that could enrich those perspectives. And then maybe a point of encouragement or question to Janine and Jen around the Crawley Community Engagement case study that you mentioned. How connected could we make that with the volunteer community resilience strategy, but also the work the charity's doing? So sort of I posit questions, not necessarily for now, but perhaps for the future. But my question was a build on Michael's, noting the positive or not negative, rather, journey in RES, still more to do. You shared feedback there from 2024 from your network members. Does it feel any different a year, 18 months on from when you gathered that, those insights and comments, or is it still a slow journey? Thanks.
Certainly, when I ask them questions to the same people, the feedback is starting to change. There's more of an uplift in sort of positive, and that's good. That's what we want.
Thank you. Yeah, so I want to reduce the burden on Amjad a little bit. Amjad doesn't lead on this for us. He, as a staff network chair, goes over and above his normal duties to be a conduit and to give the voice to various people, as do all our staff network chairs. So, Amjad, I don't want you to go away with a huge to-do list, because it's for us all, of course, to run these issues, these conversations and these attitudes and approaches through the organisation. But I would say a number of things. One is patient engagement, of course, has got a huge conscience in this space and all space of discrimination and minority groups. And we do have an issue across our patch, haven't we? Kent is under reform. And we do know that our staff that are working in Kent are feeling incredibly uncomfortable about living in Kent, and the impact just being in that societal space is causing them. And we're also seeing quite a bit of prejudice towards our call handlers, for example, if they happen to have certain accents, assumptions are made, etc. So I think, Max, your question about are things getting better? I doubt it. And I would imagine it depends who you ask and on what day and what time of day, and whether they've just been the recipients of that abuse and that challenge. So I think as an organisation, and our REST report will show, there are green shoots there. And as an organisation, we're beginning to get feedback that we are aware and we are on the right conversations. The question is, with all the pressures around us societally, you know, how much should we be doing? How much should we be speaking up as an organisation? And then what are the intentional things we do within the organisation? And certainly recruitment is part of that. And we need to think carefully about that across all the groups, because you're right, intersectionality is very important here. So I thank the board for having open ears and for the kind of questions they've been asking, because they're absolutely the right questions, but we need to reflect those questions on ourselves and see what structures we're putting into place and what processes we're putting in to either enable or disenable getting better in this representative space, because unless we have representation, we can't hear the voices.
Thank you, Margaret. That was very insightful. And David, please, I want you, and then Karen.
I was going to make a very parallel comment to what Margaret's made. So I think, and it's not a question for Amjad, it's for us as a board, because what I've heard is blue light as a barrier to inclusion. Yeah. And I think we need to reflect on that, given our strategy and given the type of organisation we want to be in the future. Because I think that could be a limiting factor for just how far we can push some of our aspirations around the type of organisation we want to be. I also want to reflect the Department of Health and NHS England coming together. So this organisation is going to be one step removed, less than it is now, from government. Therefore, I think there's something for us to reflect on as a publicly funded organisation. What does it mean when the national discourse becomes very heated, very politicised, and we see flags going up on lights on the streets, and all of that comes to fruition? I think there's some really big challenges, I think, here for us, because there's just so much that we can, I think, push forward in our current format. So I just want to invite us to, just be absolutely clear what we're hearing today is there are some real barriers to being able to push some of this. We have made some progress, but there's some real institutional barriers, I would say, still for us to reflect on. And I think it's not just us, I think others will have similar challenges in the NHS going forward.
Thank you, David. Again, some really important points I'd like to summarise in a minute, but Karen, please.
Yes, again, many thanks for such an insightful presentation. I've got a broader question really around linked to the RES as well, about abuse and violence towards our staff, both verbal and physical. And it's something that comes up in some of the papers later on as well. So my question is, are we content that we have, to the executive, do we have a sufficient pathway for staff that suffer this in terms of supporting them and getting them back to work? And I'm curious to find out more about that.
Simon, did you want to come in on that first, and then thank you.
Maybe can I just offer a couple of observations, and I'll turn to your comment. So thank you, first of all, for your leadership in this space. Quiet leadership is a very underrated virtue, and I think you perfectly exemplify it. So I just wanted to say thank you. Thank you for taking part in the podcast. So I really valued the chance to sit down with you. I want to draw together three themes, and I'll comment more broadly. The first is networks are at their best when they connect with other parts of the organisation. And I think I just really was attuning to your point, Max, about networks and how they can connect to the Shadow Board, but also to other parts of the organisation, because the knowledge that is contained in the network, when networks don't succeed, is sometimes just in the network and it actually doesn't land in the organisation. So I think we need to continue to support you to find those conduits, which is why this session is so important. I think the point that was made about, and we're going to talk about it, the volunteering strategy is really important. In fact, it's so important. I'm not going to start making my comments on it here because it's really important, but it's something that we need to continue to keep in mind. And then touching on the bit that I think you were asking us to make a commitment to, I think you found, I think we touched on this, the experience of community engagement really important. And it is increasingly clear that while I think we can point to, as colleagues have said around this table, green shoots in the organisation, positive signs, we're going to talk about those in a minute, some of our communities are feeling less safe. And that therefore invites us to think, what is our role in promoting different messages in those communities? Now, community engagement is not something that we have had a particularly structured or strategic approach. And I think what we need to come back to this board on, rather than trying to solve today, is what is our answer to that question? Because I think we need to do more. My steer is I think we need to do more of that, not less. Because one of the ways, one of the things that I think is going on is a kind of almost a dehumanising conversation in which our staff are receiving more abuse. The data we're going to come to that in a minute. One of the ways in which we break down those barriers, and I commend Carol Ann, I commend the team who did this, is by actually going out and being present in those communities and having those, making those human connections. I think that's what you, I don't want to put words in your mouth, MJ, but I think that's what you were inviting us to do more of. It's great that we did it in Crawley, but I think we need to do it all over the place. Did I hear that correctly? So I wanted to make the commitment that I think to, touching on your point, Karen, that I think we need to come back to, and I think this is somewhere where our governors also need to be engaged, because our governors are representative of their communities, that this is a presentation they need to hear. And this is something that we need to talk about with them and how they can help us in this space as well. But thank you for all that you've done over the past past year. We are in a better place because of your leadership, so thank you.
Amjad, I just want to give you my thanks as well, and I would support the direction of travel that Simon has set out. I do think it's important that we have an open debate with our governors and community first responders, because this affects all of us. These are not hollow words, but I feel really, really uncomfortable to think that any of our people that work within CCAM receive abuse. I know the political environment is changing, but we have a proper right to support our people and to be absolutely confident that they can come to work feeling safe and not abused. It's easy for me to say that as chair, but I would look to our executive colleagues to reinforce that as best as we can. But I know this is incredibly difficult, but that's the clear message I want to go from the board. I think we need to return to this subject more frequently than we have in the past as a board. And I return to my point that I think successful organisations are those that recruit from all elements of society, all parts of society, and I think that's something we need to think a little bit more. I'm very struck by Margaret's point. It's across the whole board, isn't it? It's not just particular corporate services or paramedics. It's across the whole organisation. So while I haven't got concrete steps forward, I really want to build on what Simon says, that we want to come back to this. And I would certainly be saying that as a board, we need to be discussing this much more frequently than we have before. And perhaps you can talk with Margaret and Peter about how frequently we do that. But it is an incredibly important issue. And I'm very grateful for all that you have done. So thank you very much. And hopefully you'll stay and hear the discussion about the res data. We're running behind time. I think this is a natural point to have a 10-minute break. And I promise you we will finish at 1 o'clock. I always say that. So we'll come back at 20 to 12, so please go and have a cup of coffee now. Thank you. Okay, we'll start. And so we now go on to the board assurance framework. And the first section is, are people enjoy working at CCAM? Max, you were kind enough, you've done a very comprehensive assurance report to the board. I wasn't going to ask you to go into detail on that. The only question I'd ask you is, are there any particular risks in the integrated performance report relating to people that are causing you concern or you would want to bring to the attention of the board?
Thank you, Chair. Yes, I'll take it as read and not do the usual walk-through positioning talk. What I would probably draw attention to is two areas. The first one was, as committee, we seek additional assurance around closing off the NHSE education quality intervention actions. So that's ongoing, but that is underpinned by a robust education improvement plan. And then the second is really throughout our committee meeting on Thursday of last week, we had a number of interconnected conversations relating to the organisational changes that are underway and also the Enabling People Services Improvement Plan. And those discussions recognised the criticality of these changes and sought and got assurance that broadly we're on track. But importantly, we had another dimension of inquiry, which was seeking assurance that the Trust has the bandwidth to deliver, and in addition, that we're really having at front of mind the welfare of staff, both those that are undertaking these complex changes, but also those who are impacted by the changes. And that brought us back to the BAF, helpfully, the BAF risks, because these are all risks that are recorded there, but it's important that we keep our eyes on it. And we mustn't take false assurance from the fact that the risk scores are necessarily decreasing. That is largely due to the bolstering of the mitigations rather than likelihood or seriousness of those risks themselves decreasing. So I think the message from People Committee was we mustn't rest on any laurels.
Can I just build on that one point? And I just wanted Simon to comment. So I'm very conscious of the pace of change, all really positive, but it's the ability of the organisation to assimilate that change. I think, Simon, I didn't know if you wanted to give a comment on that.
Max, I think it's a really good point. It's something that we constantly return to. The way the rain's coming down. The way in which we handle this is that we have a PMO structure in place. That PMO reports to EMB, and one of the things that we look at is, have we put too much load in the organisation? Are there things that we need to recalibrate? We did that just yesterday, so it's hot. And, Sarah, and she may wish to comment, on whom the people services transformation load falls most acutely, is actually very good at holding us to the point about, have we loaded the change programme too tightly? We looked at it again yesterday. We feel that for the quarter ahead, which is how we look at it, that we are in the right place. That is not to say all the change is done or that it is easy. We have deferred things. So, for example, we have deferred in part because of the operational issues, in part because we think there are potential for collaboration, the integrated care teams restructure, precisely because we don't want to overload the organisation. So I just wanted to give you a sense of the live debates that the executive have in this space, and it is not entirely just let's keep pressing on.
Yeah, no, I'll just close that in terms of that was one of those additional assurances that we did get at People Committee, was that commitment to sensible prioritisation, which was really good to hear from across what was a very joined up exec sort of contribution in that conversation.
Sarah, you.
Right. Thank you, Chair. So just to clarify some of those issues around the organisational change, I think the discussions that we have had is around capacity, but also what is good organisational change. So I think what we've done differently this time is a lot around the pre-engagement for consultation. So I think the field ops restructure is a good example of that, in terms of doing a number of workshops with staff and with our trade union colleagues as well to engage in that. We've also got the strategic people partners in post, which we didn't have 3 months ago. So they are the agents of change that support each of the divisional directors in implementing that, and also in terms of the corporate services. So I think we're now better in terms of capacity, but also in terms of our processes. I think they are ultimately more engaging and better led, I would say. Thank you.
Okay, thank you for that, Max, and thank you, Sarah. Could we go then on to the second item here, really important, EDI priorities and the RES data, which I really welcome. And I think, Sarah, you're going to introduce that, please.
Thank you, Chair. So I am going to hand over in a moment to Jackie Skill, but I think where we are, it's really positive to have the annual Res and Des reports to share with board. I think what we've tried to do this time is to actually look back at a 5-year tracking trend, so you can see the improvement journeys where there are, but also quite clearly where challenges remain. So I think we have got a more integrated structure across our executive team around leadership on EDI. So I think people have alluded already that it's a board responsibility, and both NEDs and execs are fully engaged in the EDI planning and the EDI priorities. So I will hand over to Jackie, who's Deputy Director for People Services, to talk us through the Res and the Des. Thank you.
Thank you very much, Sarah. So I just want to give an overall summary across both reports to start off with, and then give you a few highlights of some of the activity we've done in the last year that we believe has contributed to the positive trends, and then give you a little bit of a taster of what we're planning to do for next year. So just as a reminder, these are 2 reports that we are required. Every trust is required to produce and publish on their external website by the 31st of October each year with an associated action plan, and we did that within the time frame required. The data that is pulled to produce these 2 reports is taken from the last National Staff Survey, which was published earlier in the year in around March time, and also our workforce data on ESR, the electronic staff record, as at the 31st of March of this year. So that's where the data is coming from. If you're looking at the slides, I would suggest you looked at slide 6 for each of the packs, because that gives you the overall summary of each of the indicators. You will notice that some of the indicators in the RES and the DES reports differ slightly according to the nature of what they are reporting on. So whilst some of them are the same, some have slight differences. You'll see that we've got some really positive 5-year trends. I won't say upward, because some of them are positive because they're going down. So that is to be celebrated as an organisation. We've got somebody working with us at the moment to support us in some key pieces of work. She works nationally with NHSE and very large organisations up and down the country, and she has reflected to us this really is a positive story for us as an organisation. We recognise there's still more to do. So to note, really, in both reports, the workforce representation is on an upward trend, which is really positive. However, we do recognise, particularly for the RES, and this is something that builds on what Amjad said earlier, whilst it is an upward trajectory, we do know when you dig down into the data that the majority of our ethnic minority staff are in those lower paid roles, those lower banded roles. So there is more that we can do on progression for those groups. In relation to recruitment as well, which we've discussed this morning, we are working with Jackie's team to pull together a summit at some point early next year where we can bring together higher education institutions and other key stakeholders like the College of Paramedics to actually debate what more we can do to encourage people to enrol onto paramedic science programmes. The board representation profiles are very low in relation to both reports. As I said, this is ESR data as at the 31st of March. And because the board representation is taken from a very few people compared to the wider organisation, I would just note that we would need one member to report on the system that they have an ethnic minority background and 2 members to report a disability, and that would put us absolutely within the representation of the wider organisation. So we've taken some positive action as a result of this already and provided some support with our board members, which we're actually now doing for our SMG and wider workforce in how you can actually go into ESR and correctly record your data. We just need to be mindful that it's not mandatory. People can choose. They have a choice as to whether they wish to declare their protected characteristics on the system. We've also developed some how-to guides that are going to be published shortly. Overall, the piece of work, the indicators that are of concern, which has been of debate this morning, is around bullying and harassment. And we've already started a focused piece of work. We've started discussing what that might look like and what the data might look like with Amjad's team. And we're going to be doing some work to unpick that a bit more over the coming year. The highlights of what we've done that we believe has improved both of these reports is that we've really done a lot of work to strengthen our staff networks and also to strengthen our comms and engagement. And with that in mind, I'd just like to express my thanks to everybody who's a staff network chair, all of our exec sponsors and our NED sponsors, and also to Janine and her team for the support they're giving us in getting the word out there about all the good work that we're doing. I think it's really important that staff hear what we're doing because otherwise there could be a perception that nothing's happening. We've also strengthened our governance. We've published the quarterly EDI updates, of which you have the second highlight report today. And we're also publishing an EDI briefing, which will go out monthly and be published on our internal zone area. We produced one last month and shared it with some key stakeholders and were given some clear feedback. This is for the wider organisation. So we're now reframing it and making sure it's suitable to be published on the zone. That will give everybody a really thorough update on every piece of in-month activity and also what we're planning to do in the month ahead. There have been board development days during the year, which have really been helpful for us as a team because it's provided us with that focus for us to enable the EDI plan to be aligned to 4 key focus areas, which are staff development, data analysis, staff networks and inclusive recruitment. And that, I can't tell you, has been so helpful for us as a team. We've also provided more opportunities for lived experience to be shared in key meetings and committees, as we have today with Amjad joining us. And we've strengthened our reasonable adjustments process and it's more centralised. We've got an allocated budget and we've had some really positive feedback on that. With regards to development of staff, we had a leadership conference recently and we've been working with Jackie and her team on a leadership framework, and inclusive leadership is one key element of that framework and the development that's going to be put ahead in the future. We have a springboard programme which is for women into leadership, and thank you to Jen for her support with that. Another cohort is being planned for the spring, and we've had more than 30 people attend our Ascend programme, which is a leadership programme for our ethnic minority staff. We've got another cohort that we're planning to put forward, and we're going to look at how we can track the progress of people that attend those leadership programmes. We're also just recruiting for the second cohort of our reverse mentoring programme, which has been really successful. We've got a number of people in the room that were part of cohort 1 and have recently shared their stories in various meetings and forums. So for the next year, continuing focus on our 4 focus areas, we're going to have another board development session, a date yet to be confirmed at some point in quarter 4, to engage on the direction of travel for us over the next year, what our focus will be for 2026. From the RES and the DES indicators, it's quite clear we need to do something around bullying and harassment. We're also looking at an anti-racism framework and what that will look like, and we're aiming for level 2 with disability confident. So each of those things will help us with the broad spectrum of the indicators. So this moves us from an awareness of bias to actually deconstructing unfair systems and changing behaviours. Before I take questions, I just wanted really to ask Margaret and Richard, as the chairs of Inspire and our Enable networks, whether you wanted to add anything. Thank you.
Thank you, Jackie. So as the network exec sponsor, which is a great privilege actually, and quite a humbling position to meet staff in that space, I would say that over the past year we have seen a significant shift. I don't know if Amjad would agree with me. I think he absolutely would, in the support and the direction and the type of conversations that are being had now through the EDI team. So, Jackie, I thank you for your leadership in that. It is important that direction and that cohesion comes through across the network so that we go shoulder to shoulder and we're not showing as an organisation a bias to one or the other, which of course we wouldn't want to do. But I welcome the report. I welcome the amount of work in it and the focus on it. It's really good to know that we're going to be looking at the anti-racism framework that's coming in across through all professions. Nursing has got a particularly strong strand. In nursing, we have a large number of people from global majority or BAME, whichever way you want to put it. And there's a lot that we can learn from out there. So I'm really glad that that's happening and that your team will be guiding us and supporting us to do that. I think my only comment really to put in here is that reflecting on, we've all been having our well-led interviews, and Peter and I have been running those through the lower levels, the next layers, I should say, of the organisation. We do know that us being able to articulate this story is quite weak, which is really interesting because we've been fed quite a lot of information and we're involved in quite a bit now. So I would just ask people to ponder on that, and because even just now in the last few minutes, you've told us an incredible story and taken us through the journey we've been on. And then the other thing is how we are talking about it. We have got focus and sight on it here, but how is that cascading down through the organisation? I think that is the biggest challenge for us now across a whole load of things. So certainly from Inspire point of view, there is a connectivity there with people in the rest of the organisation. Not many. It's a network we want to grow in numbers, but certainly using the staff networks would be helpful, but also equally how do we do that in other ways, cascade the framework and the stories through. But thank you, Jackie.
Thank you, Margaret. And
similar to Margaret, thank you, Jackie, for all the work that you and the network leads have done. Enable is another small network in terms of numbers, but growing. And this year, bringing in objectives, a clear plan and a vision for what we want to achieve for our staff has really, really helped. And it's really exciting to see what we can achieve. I think the key message from Enable, which I'd encourage the board to endorse for the next year, is we're really trying to encourage staff to come forward and declare to their manager that they've got a disability, whether it's a hidden disability or a very obvious disability. That conversation is crucial, not because we want to number crunch and just produce graphs of numbers, but because we want it to be meaningful. We want staff who've got a disability hidden or very visible, that they should have a reasonable adjustments plan and we want them to enjoy coming to work. We want them to have a great time working for CCAM, and part of that is having a plan that allows them to flourish in our organisation, so that when we go out and visit services and we speak to staff, you know, that they can say that we've really supported them to give their very best when they come to work each day. And thanks, Jackie, for your guiding hand with that. So thank you.
Jackie, thank you tremendously. Really support all that you're doing, and it is incredibly impressive, and particularly taken by the the anti-racist policy that we're trying to develop. Really, really important. I want something really concrete to come out of our discussion, and building on what some of the points that Jack made, and also I know the Shadow Board has made. It's this question about bullying and harassment, and what our approach should really be, and what is the message that we can give to our people. And I was going to ask Simon to come in on that.
So, thank you, Michael. So I think the one issue that perturbs me, it's been a bit of a theme, hasn't it? And I know, having talked to colleagues on the Shadow Board, this is a lived reality for many of our staff, which is the percentage of staff experiencing bullying and harassment from patients. And I think this is a bit of a moment where we need to, in the context of some of the discussions we've had, have a think. And I'm going to invite the Shadow Board to help with this, because I don't think we will come up with an answer today. But my commitment, I think, Michael, is by the time we come back to this board in February, we need to have set out what do we think the right response is. Because we can put in place all the support that you like, but the trend here is not a good trend. And I think if we are to mean something in terms of supporting our staff, what does a zero tolerance approach to patients who abuse our staff actually mean? Now, that is a difficult area to get into, and I know it will be quite a contended area, but I think we owe it to our staff to actually have that debate out in the open and decide collectively as a board what it is we want to do in that space. Because I think we need to send a signal to the public that our service, and we see this now as a motif, you see it in pretty much every setting, don't you? Our staff are not here to be, I'm sure we've all seen it, right? Our staff are not here to be abused, we will not tolerate this, and I have this sense that we are not being as yet assertive in this space as we should be. Now, I'm not enterprising that discussion without knowing the areas I'm getting into, because equally I've heard when I've raised this point before people saying, well, we can't say no. So I recognise that there will be strong views on either side of this debate. But what I hope the Shadow Board would be up for is a piece of structured work to say, what does this mean? How do we respond to it? Particularly in the very polarised context in which we live. And I would welcome, by the February board, a discussion where we sit round a table together and we have that debate out in the open, and we decide what it is that we are how we're going to position the organisation. Because I absolutely acknowledge there is more for us to do in the support space, but if we dodge the fundamental question here, which is, what are we going to do to convey a message of zero tolerance? I'll give one really practical example here. I think we should hold ourselves to account for every time this happens, we should be debating it at board. We should start thinking of this as a never event. Because if we don't, we will never change our approach to it. It will continue to happen. And one of the things I think staff talk to me about, and I'm regularly out and about in the place, is that we almost normalise this behaviour and we explain it away. And I think we've got to stop doing that. So that's what I wanted to say. So I hope, looking at the Shadow Board colleagues, that you are up for that conversation. I think it would be a really great contribution to make. I think it would really matter to all of our colleagues that we debate it. I would invite you to go out into the organisation, seek views on it so that you are as well informed as possible. I'll work with Janine so that we do some sort of public announcement to say, I would like you to do this piece of work on our behalf and receive views. And then I think we come back round the table in February, having done some listening and reflection in the organisation, to say, what are we going to do differently? I saw some nods, so I hope that's an agreeable suggestion as to the challenge that you put to us. Thanks, Michael.
Thank you, Michael. So it was really actually to report back on some positive sort of culture developments actually that I just wanted to share with the board. So particularly around working with our trade union partners, so all of our unions, I'm pleased to say that we have now agreed a new resolution policy, which is linked to, so replacing our existing grievance policy at the most recent JPF. And the reason I'm sharing that is because I believe that this will start to shift the sort of changing culture towards informal resolution rather than a more adversarial approach to grievances. And when I was looking back sort of year on year at the level of grievances, we can see that we're on a trajectory of decreasing the number of formal grievances by, so last November we had like 114. This November we've got 81. So you can see an improving trajectory. And what I expect is that we will see through the resolution policy and its implementation, we're spending a lot of time looking, before we implement, at actually training our managers and doing some joint training with our trade unions, which is new to report, I would say. And then the other matter that I just wanted to bring to the board's attention was the positive engagement that we've had recently with our GMB union. So Margaret, I and Vicky Doodoo, who's the Deputy Chief People Officer, met with the regional GMB chair and all of our local reps and spent a good couple of hours with them discussing, you know, how we work better going forwards and improving the partnership working. And equally, we invited the regional GMB to our wider leadership team meeting, which was yesterday. And we had a really positive discussion about how we can build on the existing work that we've done to really, you know, ultimately we all want the same thing, which is making CCAM a better place to work for all of our staff. So I just wanted the board to note that because I thought that was important progress. And then to pass on to Janine just to update around some specific staff engagement activities that I thought the board should be aware of. Thank you.
So please, Janine.
Thank you, Michael. I just think it's really important when we're at the board that as well as the hard metrics, we also pay attention to some of the more informal indicators of staff engagement that continue to present a really positive picture for the organisation. So I will just draw out a couple. Our Christmas Stars campaign, which is an annual recognition campaign we run, on the 4th of December, we have already exceeded the number of nominations we received compared to last year, so well over 200. When you think that's colleagues taking the time to nominate somebody, and we continue to receive really positive feedback from colleagues on that. Second thing is our, Simon mentioned earlier, our first ever carol concert / celebrating life event coming up on Monday. 230 people due to attend already, and I'm really pleased that we will see the first ever public performance from our CCAM choir. All of these things for me are a measure of the organisation and our people wanting to get engaged in things that maybe we haven't seen before. And we were deliberately oblique in Simon's board report around our staff survey response rate because we are not allowed to formally confirm our response rate until it is confirmed by the survey providers. So what I would say is we have exceeded last year's response rate. I'll say that bravely, which is a massive achievement. But as importantly for me, we have seen every one of our operational areas this year exceed 60% response rates, which when one thinks about the particular challenges for operational staff in completing the staff survey is a massive achievement. And actually more than half of those have exceeded 70%, which when I think back to 2 or 3 years ago would have been unheard of. What we know is that also we are comparing very well to our colleagues nationally at a time when the response rate for the ambulance sector is declining overall, ours is going up. So just to give that sort of maybe slightly softer intelligence around some of those measures. Thank you.
Please, you don't need to be apologetic about it being the softer element. I think it's really, really important. And I know, Janine, you and colleagues have put a lot of effort into all of these activities, so thank you. Also, so I have been around CCAM for, I think, 7 years. This is a real step change, and, tremendous thanks to you and your colleagues for what you're doing. But also to say thank you to the GMB union and all the other unions, because, it's important that we come together in a much more collaborative way, and this is a real important step forward. So thank you. Before I give Simon, I just got to ask the question. Every time we mention the choir, everybody looks at David. So can you tell me what is it you tenor or baritone or?
You can find out if you come to the service on Monday evening.
Yeah, thanks, Michael. Firstly, thanks to Sarah and Margaret in particular for all the work they've done over the last 6 months. I just want to put on public record my thanks to Catherine and Declan, who are the regional reps of the GMB, for being in fact, this room with us and sharing and talking to, more importantly, not just to the exec team, but many of our senior leaders about what had gone on, and most importantly, listening to their experiences that they've had. And I think we made an important first step yesterday. It was a first step. We don't erase the past 10 or so years overnight. And the GMB, I think colleagues acknowledge that. But I think we all departed that room with an intent to absolutely continue the work in partnership that we had started. The policies are one part, and congratulations to the team on those. I'd like to highlight also, and I've talked about this many times before, the recognition agreement. That is a second piece of work that, although it often doesn't get mentioned, deserves its prominence. And lastly, I suppose, to place on record my thanks to the other unions for their work in helping create the conditions in which some of that partnership working can now go forward. We have a real opportunity now as an executive group, but also as a board, to reset some of this partnership stuff. And I think it's really important that we take it. It will certainly be a focus of mine in the weeks and months ahead. Thanks, Michael.
Thank you, Simon. So we will conclude that item, but I'm really pleased now to go on to the integrated education strategy, and that's over to Jackie, please.
Thank you. So it gives me great pleasure to present the strategy for the board's approval today. This is a piece of work which has been collaboratively developed. It's been led by a cross-functional steering group. We've taken feedback from a range of stakeholders, including having a big conversation with a significant number of our staff. So what we have is an ambitious 5-year strategy for you to look at today. And what we're aiming to do here is really strengthen the foundations of our development as individual members of staff, students, volunteers, to really deliver the high-quality care and be the best possible employer that we can be. There are 5 themes within the strategy. The first relates to our learning culture and environments, really kind of starting with the bedrock of what will allow us to absolutely deliver excellence in education, training and development. The second theme deals with quality management to ensure that everything that we do really meets the needs of our learners, meets the needs of our stakeholders, our patients and our regulators as well. The third theme deals with the very modern digital and technological enablement. So a big theme there will be making sure that that we support people to really use the technology that is available to us now and emerging, as well as have the right technology to deliver education, training and development effectively. The fourth theme relates to infrastructure and access and making sure that we have the right facilities for people to use, but really making sure, touching on our conversation earlier, that we are levelling the access to education, training and development so that it is equitable for all of the people that need it, that it isn't something that is only available for clinicians, something that isn't only available for people who wear green here, it's something that is available for everyone. The final theme relates to content and delivery to ensure we really match the need with the provision of education and have a real eye on the future and increasingly make sure that we are ahead of the game to develop education and training that meets the needs of our staff as that changes, particularly in a fast-paced environment, and meets the needs of our patients as we go forward. Part of that as well, we're going to be looking into commercialisation of training to help us to fund excellent education and training for all of our staff. This is a fairly flexible strategy, so I think it's probably fair to say that it will become a living document. We are in exploring the group model with SCAS now, so we're flexible to make sure that we're able to make best use of the opportunities that raises for us. There will be some investment implications for this strategy, which will be dealt with by business case. The business case system as we go along, taking into consideration the opportunities that the collaboration might pose there. There is a detailed roadmap within the strategy, which I think gives you a flavour of how ambitious this is. So I will stop there, as I appreciate you all had the opportunity to read the paper. As I say, it's presented here for approval. Very happy to take any questions.
Okay, really excellent work. Can I ask one question, then I'll open it? I presume a lot of work has gone into this. Have you road tested it with those who are going to be impacted by it, our paramedics? What feedback did you get from them?
I am still on somehow. So yes, we have road tested it. We've got a lot of feedback, both in terms of the big conversation that we had earlier, and we've had lots of staff involvement. The initial feedback that we got, and the Shadow Board, of course, thank you, Janine. The initial feedback that we got was people didn't see themselves in it, so we tried to make it as explicitly as possible that it is absolutely there for everyone. People that I've spoken to have been very, very excited about this strategy, and I think we're in a position now where people can really see kind of what it means for them. We might need to expectation manage in terms of how quickly we can deliver those things, hence that we say that it is a 5-year strategy.
Okay, thank you. Any questions? Any question?
I was just going to reflect on how exciting this strategy is, but particularly around the learning culture section. So I think we've done fantastic work over the last few years at creating a culture in the organisation where people are safe to raise incidents. And wherever you go, it's common practice now when things go wrong for people to speak up and in a safe environment, which is fantastic. The next stage for me, which is represented in this strategy, is how we spread their learning from those incidents across the whole organisation. So an incident that happens in Medway, will I walk into Gatwick and see that we've made a difference in Gatwick as a result of an incident in Medway? So I just want to support the strategy and say that that the learning culture bit is the bit that really stands out for me. So.
Thank you.
And Simon, you want?
So the first thing I just want to say, well done. I know it's been a lot of work to get it to this point, so it's good to see. And it's a beautiful segue from Richard's point, because a lot about, can somebody walk into where we are now, Banstead, and see something that's happened in Thanet, which is about as far away from here as we can get? Well, that's going to rely on the digital and technological environment. So one of the things I just want us to do as a board is to start thinking about the intersectionality between some of our strategic themes. Because a lot of what you want to achieve in the strategy depends upon a different set of capabilities in the organisation. And when you look at us compared to some of the other commercial organisations that I've had the privilege to work with, the knowledge repository that is available no matter where you are in the organisation is a key differentiating factor. And so I think when we come back to the board in February, I think a key theme I just want to put on the radar is how do we link this to what we're going to do in that? Because if we get that right, then a lot of this, because oftentimes we see strategies as things that are done from the top of the organisation downwards, and I think that's necessarily so to a point. But the best strategies create the conditions in which the strategy happens spontaneously, and that requires us to create a different architecture, in particularly our digital space. So I just wanted to draw that one out particularly and say, please, can we come back to that in February, and remember to make the point when we have the session in February that, you know, this is one of the you are a key customer of that strategy. But well done, thank you.
Yes, thank you. Many of the points I was going to make have just been made, but you would expect a part-time academic to value the importance of an educational strategy. But I think from a wider professional interest, I mean, this really is the lifeblood of the organisation. If we get this right, I think it can unlock some of the stuckness that's there. And it also helps us deliver on our ambitions towards being an innovative organisation and really building in structures and processes around improving not just clinical practice, as you mentioned, but all practice. And that's something that happens over a lifelong journey. So I just wanted to commend you and the team on that. Conceptually we're there, as you say. Now what we need to do is deliver on that, and I look forward to hearing updates on how that comes together. But well done, Jackie. Thank you.
Thank you, Karen. And Paul, please.
Yeah, great piece of work. Very timely as well, actually. So I'm wondering how it fits into the work on the clinical model, which is great as well, and also the longer term workforce strategy, because it's really making sure we're fit for the future, isn't it? Those things all have to come together. So I just wondered how that was going to happen.
Thank you. So the principal vehicle as part of the strategy for that to happen is the training needs analysis, which will be very, very interwoven with the models of care to make sure that we're looking ahead into the future for the skills attributes that we need to deliver the models of care, so that we can plan that into our where there is a training requirement, that we can plan that in.
It's just the timing of it all, and you know, because we needed it all yesterday, like everything, didn't we? That's all.
Challenge, Paul. Thank you very much. I'm going to conclude this, but one thing I take from this, Jackie, is that we've talked about the group model, and it seems to me that the education strategy is something that you should span both organisations. And what I'd say to people in the organisation is, if you're concerned about the group, for me it's quite exciting, because I think it'll offer a whole range of new opportunities for our people and for SCAS people, you know, coming together, working together, looking at career opportunities. So this is one of the real fundamental building blocks that we need to, not going to be easy, I know, for all the challenges, but we mustn't lose sight of that. But thank you for what you've done. This is really exciting. And I really take what you said, Richard, the learning culture that is evolved over the last couple of years is really powerful. So thank you. Go back on again.
So just to confirm that's been approved then.
Approved,
Yeah.
sorry, yes. Thank you very much, Holden. So definitely approved, Jackie, for the board. Thank you. Liz, sorry, you've been very patient there. Can I turn to you to give your Quality and Patient Safety Committee report, please?
Thank you, Chair. And I'll be very brief, as Max was, because we've covered a number of the areas. So I'm going to focus on the alert areas, and also I'd like to express my thanks to Karen, who chaired the QPSC last committee while I was on leave. In terms of the alert areas, I think the strategic priority virtual care is rated red at the moment, and this is primarily due to us being quite adrift from our hear and treat target. and our targeted interventions are not really impacting the desired outcomes to increase our percentage of patients going through Hear and Treat. So the key risks around this are due to training delays and workforce capacity. And we also understand at the speed we were trying to introduce this. And I think the speed has actually compromised from an education, training and partnership perspective, that our people haven't in the past been taught how to undertake a virtual consultation. So it's mainly based on clinical decision support systems rather than a people intervention. We're working hard to mitigate this and to try and grow this, but I think it might help if Jen doesn't mind giving an update on this after I've done the next risk, which is also linked. So our next alert risk is EOC. We've discussed it in the past. We're aware we had a quality summit in August this year linked to the issue with non-compliant call audits, inconsistent staff performance, insufficient training. Several improvement actions have now been completed, and the impact of that will continue to be tracked by QPSC. But we're also aware that CQC did visit us in the past couple of weeks at both Medway and Nexus House and carried out an inspection of those areas. So I think it would also help the committee if Margaret gave an update on that. So I hope, Chair, it would be helpful for Jen and Margaret to comment on the two red alert areas.
Okay, Liz, yes, very much. I'll take your guidance on that. So, Jen, do you want to, and then Margaret?
Yeah, absolutely, by all means. The virtual care priority, agreed. I think we haven't yet made the progress in delivering the outcomes that we want to, which is why the programme is still rated red, and Liz quite rightly flags it as a risk. The slightly better news is that over recent weeks we have started to see an increase in the clinical productivity, both in EOC and more recently in the local hubs, following implementation of kind of greater visibility of this as a priority, management oversight, data to manage the system. And we are also working together with Jackie's function to put together a more impactful training plan to address some of those concerns, Liz, that we train people well, I think, on the decision support tool, and a number of our clinicians are good in remote clinical assessment, but we haven't necessarily done that in as structured a way as we would wish to. So that's a focus moving forward, and we considered that at EMB yesterday, acknowledging that we're in the process of developing a longer term clinical model for virtual care, and so clearly that will still need us to support our clinicians with training, still need us to oversee robust levels of productivity with NHS resources. So those things are absolutely no regrets actions, but they need to be aligned with the longer term clinical model as we move that forward, and we're bringing an update on that to committee, I think in January or February, whenever the next committee is. So yes, it's not fully where we want it to be, but we are making a little bit of progress now on virtual care productivity, and we are putting actions in place around those training areas. I think I'll hand over to Margaret to speak in more detail about the EOC leadership, culture and quality work, which is also very extensive in its action. We've had a check and challenge review from external OD consultant, which gave us some helpful insights, and now that will supplement our action plan that we have already around the leadership and culture space. Sarah and I have led on that with the EOC team, and I think there's positive news in regards to what we've found out from the CQC visit, so that can give us some further assurance. Margaret, would you prefer to speak to that?
I'll ask just one question on the first point. So, Hear and Treat, I understand the difficulties. How do we compare with other ambulance trusts across the country? And I know this is difficult because we might not be preparing, it might be apples and pears, but I'm interested to know, are there any lessons that we can learn from the wider ambulance sector?
We're not the best, we're not the worst. The learning really from other sectors, and indeed from the guidance which is now flooding out from our various guiders, if that's a word, is very much that sort of at-scale multidisciplinary clinical assessment services seem to be the most effective in delivering virtual care at scale and with good productivity and outcomes. Obviously, that's quite a high-level statement, so working through like how that would be best adopted within CCAM and in the broader South East region is something that we're working on at the moment as part of the future virtual care clinical model work. So I think we will continue to enhance what we're doing in the structure that we currently have, because there is certainly room to improve the kind of the oversight, the data, the training, the support that we're giving people, and to hold ourselves to account for the level of productivity we should deliver for our patients. But that, as I said, needs to be in the context of this model where the general trend and guidance seems to be at multidisciplinary at-scale services.
Can I ask of Simon? So, obviously, if we don't meet the target, the main emphasis that we need to be focusing on is patient care. But are there any financial consequences from not meeting the target? Simon, I don't know if you wanted to come in on.
No.
Because this is very important. Karen, you chaired the committee on Liz's behalf. Is there anything else you want to add to this particular issue?
No, thank you. I think Liz has covered it admirably. Thank you very much.
And Margaret, over to you on EOC.
Thank you very much. I won't refer to the EOC Quality Summit or the outcomes from that because we went through it in great detail at QPSC. But Liz, you asked me to talk about the link of that to the CQC. So I will be talking to the board a bit later on in more depth about that. But we did have a visit only last week, actually, Liz, not a couple of weeks ago, it's only last Thursday and Friday, into Crawley and Medway. They had 2 full days. They listened to hundreds of calls. They really were very focused on patient safety. They had read previous reports very, very thoroughly. So they came with homework done with very, very targeted and framed questions. So it was a good visit. Our people thoroughly enjoyed it. And CQC made note of the fact that our people now, for both their visits, remembering they came on 2nd and 3rd of October to all our field ops sites, that they were welcomed and people enjoyed speaking to them. Then they don't usually see that. So that's great testament of the work we have been doing over the last 3 years, because that's exactly this. What we do is for CQC. It's for our patients, our families, our loved ones, you know, our community. So all positive vibes came back from them, particularly around the staff, the care and compassion and support that our core handlers give their patients. They saw clear and significant improvement from the last reports. They could not actually point to any areas for development in that initial feedback. Remember, they give us feedback almost immediately. They still need to get all the data requests in, and they've got some interviews to do. So until the show closes, the show doesn't close. But so far, very, very positive visit and response.
Thanks, Margaret. That's really good to know, and tremendous thanks to our colleagues who work in those centres. I know it's not easy, so to get that feedback is really, really important. Any questions, Margaret or Jen, on this particular, or Liz? No. Okay. Paul, please.
Yeah, it's just our strategy is really dependent on delivering virtual care, and and the care hub, UCRs as well. I just wondered if we had an action, do we have a coordinated plan? Because we've had plans in the past, they haven't quite delivered. It is quite important to us, that's all. It might not have any financial impact, but in terms of the longer term strategy, it's the key plank. So are we taking it seriously? I suppose that's my question.
Very much so. Beneath what Jen said around the guidance issued by our guiders, because that's now stuck in my head, there is a lot of work going on and already has taken place in terms of what model do we need to put in place for the upcoming financial year that addresses this issue of scale. So if I leave the board with one thought, it would be scale seems to equal improvement. So we are grappling with how we deliver scale at the moment. The other point that you make is quite right, and we haven't touched on that, so I'll just draw that out now. Even if scale happens, none of this is successful unless we agree what can be delivered in the community settings that allows us to defray demand away from an ambulance successfully into another service that needs to exist. And we know that our urgent care centres or their analogues remain stuck at 20% acceptance rates, and that is a critical rate limiting factor for us. I remain really worried about that, in part because of the enormous change that the ICBs are going through. It's difficult when you're managing that level of change to be focused on service delivery. I'd say, Paul, it will be a key part of our planning discussions about the assumptions that we can rely on, because if we track back to the assumptions that have changed in this year, the ones that we all signed off at the board, the material change has been what we thought would be delivered in the community that has not been delivered. And therefore, we are going to have to revisit that set of assumptions in our planning discussions, just to be clear about it. I don't have an answer. The bits that we can control, what I would want to say is, rest assured, we are taking it very seriously, and I expect to be coming back to the board in February with a proposition as to this is the model we now propose.
Thanks, Paul. That's a really good question, and I welcome what Simon has said, that coming back in February, because the scale issue seems to be really important. So thank you for that question. I'll conclude the section on patient quality and now go to sustainable partner and hand over to Simon. In Suzanne's absence, I think you're going to actually talk to the assurance report that came to the board. So thank you.
Yeah, thank you, Michael. So taking the paper as read, I'll just highlight the main topics of discussion at Finance Committee a couple of weeks ago. So to expand on the point earlier around financial risk, we did at the committee discuss reducing our BAF risk number 640 down, because we've now had confirmed the second half of the £10.2 million performance funding this year. So that's been earned, and that's safe now. So that's allowed us to reduce the overall risk score there. So we are more confident that we will be able to deliver the financial plan this year. Work continues on the plan for next year. We had a really good presentation from vehicle and driver safety colleagues, driver standards colleagues. Noted all of the good work that was being undertaken and the reduction in collisions, particularly since December 2023 to date. But obviously we want that information to be more widely shared across the organisation to publicise that good work and the impact on the organisation and wider communities. Consistent with that, we looked at the financial performance for month 7, so on track year to date and break even for the financial year. We contributed to the ongoing development of the estate strategy, so some feedback from colleagues. We're looking to bring the estate strategy back to board probably in February, once we've taken more wide input from people, particularly around our training estate and how operations want to use the estate going forwards to support performance. So we'll continue to route that through Finance Committee as it develops. We signed off a business case for investment, which will come through to part 2 at today's board, for fire improvement works and some works in Hastings. The committee were particularly interested to understand the fire risk assessment works that have been undertaken, and their origin and what we do about those. So we'll do some more work there. I think in discussion with Margaret, that'll come back first through Health and Safety Committee to make sure we're not going out of sequence, but we will bring that back to Finance Committee as well. And then two key areas of development and improvement work around digital. So noting the ongoing developments there, business cases and procurement to support our future direction, and again the procurement that's underway for patient monitors or defibrillators that we expect to conclude this year. In fact, we do want and need both the digital capital and the defibrillator procurements to conclude this year. Would quite like to spend all of our capital funding, £28 million. Nationally, we're quite behind as an NHS on spending capital. We are no different. It hasn't helped that for the last few years we get an annual allocation for capital, which makes planning for large investments quite tricky. But pleased to see that in the broader context of the allocations announced a couple of weeks ago, that capital we have got sight on for the next 4 years. So that should allow us to develop our capital plans more effectively and to make sure we're spending it well in advance of the end of the year. I won't say any more than that, Michael, but happy to take any questions. I might refer to other colleagues if I get stuck, but anything on the finance, hopefully, I should know.
May I ask one question, then I will open it up. So it's really good news what you're saying. We'll get to a break-even position by year end. The efficiency programme seems to be going. What are there any? We've got 3.5 months to go before year end. What as a very experienced finance director, are there any worries or concerns that could knock us off course that you would, which doesn't always necessarily come in the risk register, but I'd just like your personal view on this.
Not in a risk register.
Well,
the very thought. Of course, it's in the BAF and the risk register and the IQR everywhere.
Of course.
No, I mean I think the important part of planning is to make sure you've got a plan, and that plan's deliverable. And again, we've been very conscious as a board to agree to plans that we can deliver on across all of the planning parameters: money, quality, performance, people. Ideally, you would want what I would call downside mitigations, or Plan B, if you want to put it like that. So we have done a lot of work this year on the Plan B. So our cost improvement plan, as it was originally drafted, wasn't deliverable. So we did a lot of work with the senior team to identify further mitigations that we have enacted this year. So things like delaying intake of newly qualified paramedics, instituting a vacancy freeze in the second half of the year for non-frontline facing roles. There are other options. So we have layers of confidence in delivering the plan. We've also improved our underlying recurrent deficit from an opening position of around about 13.5 million down to 9.6. So again, a forecast improvement for the end of the year. We have to continue that for the year. So it's about trying to balance the finance with what we want to do as an organisation, what we need to improve as an organisation, what we need to deliver for our public and our people. So I suppose in quick summary answer to your question, is there anything that could knock us off track? I don't think knock us off track, but are there things that could impact our trajectory to year end? Yes. So clearly, if we have a nice, dry and relatively mild winter, that would be ideal. If it's a really, really bad winter, then we had a conversation at execs yesterday where we acknowledged that we might have to be quite agile in response to that.
So increase over time, stuff like that?
those sorts of things we keep a very close eye on over time at the moment, but those are, you know, that is one option that we could use through the coming months if that were needed.
Okay, and to build on that theme, and then I will open it, is, so you've done some really brilliant work, you know, all credit to you. Do we start the next financial year weaker or stronger than where we went?
Oh, much stronger. Our approach to integrated planning continues to improve. It will improve into next year. We didn't get everything right this year, but it will be better next year. Will it be perfect? No. So we've still got places where we can be more productive. I don't look out and see an organisation that is 100% efficient.
No.
So that's encouraging, because that gives us somewhere to go. We've heard all of the improvements we're making across a lot of the parameters we want to make improvements across, and that's important to sustain. So we do start next year, we end this year better than last year. We continue on an upward trajectory. I think that's a really good place to be. Are we resting on laurels? No, we are clear about the areas we need to improve on. But you know, we'll talk more about the allocations that we were notified of a couple of weeks ago. But I think and I said this in my presentation, I did my little video clip. I promote this wherever I go, because I think I've had 4 views compared to Jackie's 2,000 in the first 5 minutes. So, I think we've got reasons to be optimistic and confident. That doesn't mean it's easy, but our ability to deliver against a challenging environment grows. So that's the basis on the confidence, I think.
Okay, thank you. Can I open it to questions? Paul, please.
No, I'd agree, actually. I think we've seen, I've been through 2 or 3 or 4 of these cycles, and I don't think we've had as much granularity or detail or dynamic management on especially the capital plan. You know, that we're coming up with detailed plans to spend all the cash now. They used to happen much later in the year, you know, so it's much less of a panic and it's much more agile than it has been, so well done.
Excuse me, it was really helpful summary, Simon, and I agree we're in a strong position, both as an organisation and as a sector. We're being empowered to be part of the shift from acute to community and to utilise digital in a different way, and part of those kind of broader NHS shifts. I think it's important for us culturally to remember that because we're in that strengthening position and we're in that what you could call a kind of growth environment, you know, or at least in the context of the wider NHS growth environment, we need to think carefully about how we both internally still hold ourselves to account to make difficult decisions about productivity and efficiency, because we are not, you know, as, and perhaps no organisation ever is, as efficient as we can be. And sometimes that means we need to do difficult and not necessarily have more. And then secondly, also I think Simon touched on it, we have an obligation to the system to support patients in the broadest sense across the urgent emergency care pathway as one of the kind of providers who is in a position to do that. And so that's something I'm very interested to explore medium to longer term. So I think when we have those strategic discussions with commissioners that a number of us are part of, that theme is really important, how we do that both as an organisation and regionally.
I too would just want to answer your question. Thanks to the work of Simon and his team. I think we would all acknowledge our control environment is better, our audit rating is better. I would also like to acknowledge that the restructure has now been completed in the finance team, which is not an insignificant move forward to position us going forward. So well done. I mean, that's not been, I know, an easy task. So I too think we're in a stronger place. I endorse the comments that have been made around productivity. I think the other point I would just want to draw out, because we're heading into the planning round, so I'm going to just draw out 2 points. One is, we'll be talking about this in due course, the NHS is pivoting away from regional or commissioner assurance to boards taking the lead role in assurance. And so we will be expected to scrutinise our plan, and I think there are various, I can't remember how many now, assurance statements that we will be... 16, thank you. I knew I'd learn a new number there. 16 assurance statements that we will be required to sign off. Never let it be said we're wanting assurance statements. But in delivery of that assurance statement, one thing I think we should hold ourselves to account for looking at is how well integrated is our plan? So what does our activity plan link to our clinical model, our workforce plan, our capital plan? And Simon's already talked, we have made progress. I think, and again, our planning is better than it was, but I think we have further steps to go. I don't know what you think, Simon, in bringing that integrated element into it. So pivoting all of those big pebbles together and making sure that they form a neat series of stepping stones, I think is going to be the key challenge for this board. I welcome your thoughts on that, but that's certainly how I'm approaching this challenge.
Yeah, I think absolutely. I think integration is something we noticed early on. We were planning in silos. We don't do that anymore. But we clearly have further to go. And some of these things are not because we just didn't want to do it. Some things were around the environment we were working in. So, for example, our ability now to look at how our rotas match demand is not something we could have done 2 years ago, but we can do it now. We have had annual capital settlements for as long as we can remember. Now we know over the next 4 years how much money will be allocated to the ambulance sector for fleet investment, ambulance replacement. So David's team can begin to plan much more confidently rather than wait until we get the absolute numbers confirmed by Treasury. We can start to book build slots with our suppliers. We can start to more systematically look at how we introduce new fleet and remove old fleet and how that integrates with operational performance. So some of what we can improve is because of the environment we're working in changing to our advantage.
It's really assuring, and I take great assurance from that. But Jackie, please.
Thank you. I just wanted to add some emphasis to the comments that Simon made about driving standards. If I may, we had Alice's parents join us a few months ago at the board, and I'm just very pleased to emphasise here that we really are seeing the fruits of the labours of our team, particularly the driving standards team, driving training team, and our operational managers and leaders that have been really working hard with our teams on this issue. And we are seeing a reduction in the number of road traffic collisions per 100,000 miles. That is coming down, is at the lowest level that it's been for some months now. We're also seeing the panel referrals, that the incidents that are of such severity they need to be referred to the panel coming down, and in particular we're seeing areas now that are having significant reductions in the amount of single vehicle collisions and the amount of reversing collisions, and hats off to Gatwick OU, who have had no reversing incidents for 4 months straight. So we are seeing really demonstrable improvements now as a result of that. I just wanted to highlight that.
Thanks, Jackie. That's really important, and it's really important to know that progress. So thank you for bringing that to the board. Can I ask one question? And this relates to our joint working with SCAS. There's been this issue around the CAD. Have we resolved that at the moment? That we're not having no regrets decision?
Yeah. Thank you. So we're working closely with Nick and Craig and their respective teams to bring forward a plan for a joint platform. This will be coming to the board, I suspect, through Q4. We're going to be reviewing it together in our first joint exec meeting in January. But we have agreed to an MOU and some principles of how we're going to take that important piece of work forward.
So the message, I as chair of CCAM, I can be assured that working together that we're going to get the optimum solution that delivers value for money for the taxpayer, and that's a message I give to SCAS as much as to the CCAM board. Can I get that assurance?
Yes, Michael, certainly. So we're working together on a weekly basis on that, but I would add that we are also working with Southern Ambulance Service Collaboration and looking at the opportunities for consolidation at an even greater level. So our first priority is to make sure that SCAS and CCAM can work optimally together and take the opportunities of refreshes in that space to support any changes in operational processes and that can be facilitated by it. But actually the scale thing, the opportunity is wider, and we're actively working with chief digital officers across all 5 trusts to look at the opportunities for both hosting those systems differently and co-developing them and bringing together some of the data in meaningful ways that helps us operate better.
Okay, thank you for that assurance. It's really, really important, actually. Unless there are any other questions of Simon and finance and digital, no, I can't believe it. We're 6 minutes early. Any questions from the public?
No.
No. Okay, that's fine. Can I conclude? It is the last meeting, public board meeting of 2025, almost at 2026. I genuinely want to say to express a number of thanks. Firstly, for those people who work within CCAM, whether you're a community first responder in EOC 111 or a paramedic on the road, genuine thanks from the board from all the work that you do to support our communities and the excellent service that you deliver. I would also like to say tremendous thanks to the executive team. What I've noticed over my time as chair and before that, how you really work together as an effective team, and that's not easy to do, but just watching today how you've asked questions of one another, how you've challenged, that shows a really professional team, and I think the future looks good for CCAM in that respect. And I know Simon has given excellent leadership in this space, but it applies to all of you. Genuine thanks. And my final thanks is to my non-executive colleagues for the support that they've given me over the last 9 months or so. And just to say, I hate to say it, it's only the 4th of December, but I do wish everybody happy holidays, if that's the right expression to use today, and thank you very much. I think we get back together at 12:30. I don't think there's any lunch. 1:30, I'm even getting faster. But I bring the meeting to a conclusion. Thank you all very much. Bye-bye.